In your opinion, what do you think are the barriers to making a diagnosis of dementia for a GP?
I think GPs sometimes feel intimidated by that. I think they also, at the moment, see it as a secondary care responsibility. And I think the working GP will tell you that their time is fully taken up. And the other thing I think is that how they're going to, who's going to fund it, because they will see this as additional work. And I think the toolkit actually works quite well because it demonstrates that the process isn't that difficult. I timed the toolkit and I could complete it quite easily as a GP in less than 10 minutes. If you've got somebody else supporting you in doing that, i.e. a practice nurse or an HCA, the GP time is even less than that. So I think that certainly helps with the time issue. And because it's so well structured and it explains what you're doing and why you're doing it, I think it works well to fill that skill gap that GPs sometimes feel they have. And I think the other good thing about it is that GPs at the end of it don't have to make a diagnosis, but I think the more they get to use it, the more they will feel or ask themselves, why am I not making the diagnosis? So I think it's a good way for GPs to start understanding that it's not as difficult as they think, it won't take as much time as they think. And where they feel they need a consultant, they will know that the consultant input is needed. So I think it will help GPs do the work they I feel should be doing, but sometimes find they don't feel that they feel comfortable with at the moment, so that they will be able to do that and we'll get a better quality of diagnosis.
Care homes really value getting this diagnosis and it helps them structure their care. But from your perspective, what makes it, what would be the benefit from a general practice perspective of people in care homes definitely having that diagnosis?
I think if care homes know how many people and recognise how many people within their organisations have cognitive problems, or mild to quite severe, then I think they will then be much happier to refer back to the GP to diagnose. I think that's one important thing. I think very often the problems that care homes see with some of their patients is that that they find them difficult to help support. They're not doing what they're being asked to do. That's the patients that it's difficult to manage their needs, and that's often because they don't recognise that the diagnosis is there and is stopping them being able to do that effectively. So I think what I would see care homes hopefully doing is developing an awareness of dementia, but as you move on from that and get the diagnosis made and you begin to learn how you can change their behaviour and meet their needs better, they will begin to become more positive about the diagnosis and maybe learning the skills to manage that from a professional point of view as part of their work. Now, from a GP's point of view, obviously having another group of carers who understand what's going on and know when to refer in, when not to refer in, where you can have a conversation that isn't sort of confrontational. Why are you calling me? I need your help, sort of thing, and you're not helping me in the way I'd like you to. The discussion is, what's the problem? Well, let's try that again. That worked the last time, didn't it? And that's much more of a constructive way. And if they find that neither of them can meet the needs, then they know they need to go somewhere else. So I think it supports all of them in identifying and managing the needs of the individuals. And of course, when you look at the needs of the patient, you also have to think about the needs of the carer. Now, the carers, I think, sometimes find it difficult to see their loved ones deteriorating. They might blame the staff for not meeting the needs, not recognising that it's very difficult for the staff to meet the needs of an individual because of the lack of a diagnosis or lack of understanding of what's causing the problem. So I think the carers will feel supported by having the diagnosis, and it will mean that their loved ones' needs are being much better met. So I think from a care home staff perspective, it helps them manage patients better, empowers them to deal with issues that they can't deal with at the moment by increasing their knowledge and their confidence in taking their concerns forward to the GP. I think from the GP's point of view, it adds, if you like, the care home to their primary care workforce. They can work more closely with them. And I think from the patient's point of view, obviously their needs will be met, and from the carer's point of view, they will be more comfortable knowing the diagnosis and knowing that it's recognised, and having a conversation then with the care home staff about how those needs are going to be met is much, much more helpful for them as well.
Okay, and one of the things that we did realise when we did this was that even though the diagnosis was established, often the care home didn't know it. So we had a number of situations where the toolkit was completed, it went across to primary care, and it became completely apparent that the diagnosis was known. Just two questions really. One is, what do you think the reasons for that might be? And the second is do you see the toolkit then as a potential bridge to facilitate communication between the two organisations or the two groups of professionals?
I think communication, answering your second part of your question first, is I think communication is the answer. There is the past medical history is not always well presented to the care homes. They get some details about the patient's needs, but often from the family, or if they're coming out of hospital, from what the hospital put on the form, the past medical history form, and that is not always what the GP has. So the communication, the better working with primary care, with the GP surgeries, I think will improve from that point of view. So in other words, I think that if we facilitate the better working for care homes and GPs to meet the needs of people with dementia, that communication should grow out of that, I think.
Okay. So there's a facilitation of that conversation by using the toolkit as a kind of a structured way of linking the two different groups.
Yes.
One of the things that often happens when we're talking about this is that people feel that there's no point in making a diagnosis of dementia in a care home because people are already looked after. So why on earth would you need to go and make that diagnosis? They see it as just a checkbox exercise. What would your opinion on that be?
If a patient has undiagnosed dementia, they are often not eating as well as they should do, not taking the medications as regularly as they should do. And these all have a negative impact upon their health, because obviously nutrition is very important as you get older, and taking the right medications is clearly important. So I think without having the diagnosis, you're not able to look after their physical health problems as well as you would want to or expect to. So I think it has a real negative